Hello, my name is Sarah Madsen, and I am doing an informative speech about lower back pain and degenerative disc disease. I have with me today my audience, Ryder Madsen, Freya Madsen, and Park Madsen, my husband. All right, have any of you experienced or known someone who has experienced lower back pain? I think it is safe for me to guess that the answer to that question is yes. In fact, the CDC estimates that nearly 40% of Americans experience lower back pain in 2019. Lower back pain is especially common among older adults. Degenerative disc disease is often a cause of it. It cannot be cured, but there are preventative measures that can be taken to prevent and slow progression of the disease and help with symptoms. You may be asking yourself, what is degenerative disc disease? I'll start by giving you a very simplified lesson about the anatomy of the spine. So the spine is composed of 33 vertebrae, each divided into three main sections. We've got the cervical vertebrae, the thoracic vertebrae, and the lumbar vertebrae. In between each of these vertebrae are intervertebral discs. I've kind of tried to make it clear by coloring them pink and the black, but you might not be able to see it. According to Donnelly, Hanna, and Varicello, the job of these discs is to absorb shock, help with flexibility, and provide support for the entire spinal column. When these discs are injured, they can bulge out beyond the perimeter of the vertebral body itself. So here I have a normal disc. You can see that it's not poking out or anything. This one is bulging and it's putting pressure on the spinal cord or the spinal nerves that are exiting. And then this one is thinning. That's also a symptom of degenerative disc disease. So degenerative disc disease simply just refers to the degeneration of intervertebral discs due to aging, wear and tear, and or injuries. When the discs bulge, like I said, they can push against the spinal cord or exiting spinal nerves, which often results in radiating back pain or shooting nerve pain down the leg, which is also called neuropathy. Dr. Mohammed Biden, a neurosurgeon at the Mayo Clinic, points out that this can often happen in any of the area of the back, but most usually it happens in the lumbar spine. Although degenerative disc disease may sound like a scary diagnosis, if it is caught early enough, there are treatments that can slow progression and help with symptoms. The first approach to treatment is always a non-invasive one. Dr. Andrew Nava of Johns Hopkins Medical Center recommends physical therapy, massage, and acupuncture. Since pain can often be emotionally taxing, he also suggests meditation, yoga, and mindfulness practice to help with the emotional and mental symptoms that accompany chronic pain. According to Dr. Biden of the Mayo Clinic, medications can also help. Non-steroidal anti-inflammatory drugs such as naproxen, ibuprofen, and meloxicam are often prescribed. Muscle relaxers and neuropathy drugs such as gabapentin and pregabalin can help with neuropathy. Opioids are rarely used long-term just because of the risk of addiction. In addition to medication, steroid injections can often always be helpful. The procedure involves injecting a powerful steroid into the area where the diseased disc is, right in there in that epidural space. The strong anti-inflammatory properties of the steroid injection should help with both back pain and neuropathy. However, if these conservative methods don't work, surgery is also an option. There are generally three approaches to back surgery for degenerative disc disease: discectomy with fusion, and disc replacement. The discectomy procedure is done through a small incision in the lower back where the surgeon removes all of the diseased disc. Depending on how diseased the disc is, a spinal fusion may be done in addition to the discectomy. A fusion is done through a little bit of a larger incision, and it can be done through the back or the abdomen. During this procedure, the surgeon uses hardware and bone grafts to fuse the two vertebral bodies together. Disc replacement is also a fairly new procedure. And according to the American Association of Orthopedic Surgeons, it can relieve pain without sacrificing the range of motion that spinal fusion does. In this procedure, the entire diseased disc is removed and replaced with a synthetic one. In summary, intervertebral discs are susceptible to disease like any other tissue in the body. And unfortunately, it's a very common condition, especially in older adults. Disc degeneration, aging, and injuries all contribute to lower back pain. Although many people experience this painful condition, and it can be complex, there are options for treatment that can alleviate symptoms and slow progression of degenerative disc disease. Thank you for being my audience, Park, Freya, and Ryder. Thank you for being patient and listening.